Hello, this is Eric Topol, Medscape Editor-in-Chief, and I'm delighted to have a chance to have a conversation one-on-one with Yang Gu from MIT previously, and now doing incredible work on COVID-19. So welcome, Yang.
Thank you, Eric. Yeah, it's an honor to come on Netscape today and chat with you.
Well, you are the first data scientist we've ever interviewed, which is amazing. I mean, that's amazing. And I know we just spoke, you're only 27, which is also amazing. And your contributions have been vast. But I thought what we do before you went to MIT and did your double major in electrical engineering, computer science, and math, and then you got a master's degree at MIT, and you've done all this work with natural language processing and at CSAIL.
Yeah.
I thought what we do is kind of let's go back in with your young upbringing and some of your prior work in data science. So where did this all get started with you?
Yeah, so I studied computer science at MIT, and it wasn't until probably my master's that I started kind of getting into machine learning and data science. So I was actually more of had a systems background in my undergrad, but for my master's, I kind of worked on natural language processing and kind of using deep neural networks to do a lot of these difficult NLP tasks. And so that's kind of how I got my first exposure to kind of big data and using kind of building statistical models to make predictions from data. And then after I graduated, I actually spent a couple years working in finance. So that's kind of where I further honed my kind of modeling background, I guess, because I mean, as you can probably imagine, it can get very quantitative and kind of the goal there is to just like be as accurate as possible. And so
Well, that's where a lot of the great algorithmic talent goes, is to the finance industry, right?
yeah, I've met some really brilliant and talented people during my time there, and so I actually felt like kind of that during my couple of years that helped me kind of develop the skills that I've been using now for the past year, and kind of making sure that my kind of COVID modeling is kind of up to par and can be as accurate as possible.
But you also did work in sports analytics too, right?
Yeah, so I did some work in that, and actually I was working on that right before kind of the pandemic hit. And so actually that's kind of one of the reasons how I got started in modeling COVID, because everything was shut down in March, so I impacted, like many Americans, impacted myself as well. And so I actually was just curious to see kind of this where COVID was going and when kind of it can potentially be improved. And so I felt like the existing models at the time, kind of back in, this was March 2020, didn't really quite, weren't doing as great of a job as I thought they were doing. So I just thought I would kind of take my own shot and at building a model and see kind of what I can do.
Right.
And I guess it kind of took off from there.
Well, yeah, you're not kidding. It took off. Well, before we get into COVID-19 projections.com, which you single-handedly, right? I mean, this is just you. You don't have a team, right?
Yeah, I guess it's just myself and
It's YG Yang Gu COVID-19 projection. But before we get into that, did you know when you were in the crib that you were going to become a computer data scientist guy? When did you figure this out?
I actually didn't want growing up. I mean, I liked kind of the maths and sciences, but I had really not much exposure in computer science until kind of towards the end of my high school. where I have kind of a really good computer science teacher um,
Mm.
that kind of helped teach me. And so I guess also like my dad was the one that was kind of pushing me to study computer science, because that's what, that's his kind of expertise, and that's what he is doing. But I was always kind of like, oh, like I don't want to do what you're doing. I want to, take my own path. But then kind of once I got into MIT, I kind of saw how much kind of this technology and computer science is really changing our world, and in many instances for the better. And so that's kind of what inspired me to kind of dive into it and learn more about it.
That's really fascinating. And maybe there's a little genetic talent component to this, but you have definitely found a sweet spot of need, unmet need. So here it is, March 2020. The pandemic is starting to go into full force. You're looking at all these models out there, like the University of Washington, IHME, and others, and you see they're really not performing very well. So you say, I'm going to set one up. Is that basically you said, I'm going to, basically, uh, I mean, when you made that decision, which was a big deal, because you became in the vanguard, you became the number one go-to modeling force out there. Uh, what was it that made you think, oh, I can do this really well?
Yeah, so I mean, I didn't expect going into it that I was gonna become, right, like have this model that everyone in the world is going to look at. I started Bazi because I was just kind of curious to see where this trajectory was going. Because I think at the time in March, right, things were getting worse and worse by the day, and so the question a lot of people had was kind of, when will things peak? And so you had kind of two spectrums. That one model, say like the IHME, had, forecasting like 60,000 deaths by the summer, and then on the other spectrum you had kind of, I think, the Imperial College model that was estimating like 2 million deaths by the summer. And so that's a pretty quite wide range. So
Yeah, yeah.
I mean, I didn't really know what to make of it. So that's why I thought, it's better to just kind of write my own model and see,
And
who's right.
what were
And
your inputs that made your model perform so well, you think?
so yeah, I actually think that the answer to that would be better as phrased as kind of, what inputs did I not use? Because the only
Okay,
input that I
good.
did use was previous deaths, and that's it. And I felt like kind of the other models out there were kind of just using too many input sources, too many data. And
Mhm.
kind of from my experience, when the signal in the data is so low, the data quality is so low, the more data you give it, the worse your outputs tend to be. So that's why I didn't want to make it too complicated. So actually, I decided I'm just gonna use deaths, and I want to make it as simple as possible. So I kind of just built the whole model in, I think, less than a week. So I had kind of
Wow, wow.
uh, from beginning to when I had the website up, it was kind of just around a week. Uh, and then
Well, and it became the go-to model. Wall Street Journal, The Economist, New York Times, Washington Post, CNN, NPR, Nate Silver. I mean, everybody. I
Yeah, well, I
quickly
guess
learned.
I'm curious, how did you first hear
I
about
mean,
it?
I learned about you through Twitter. Some people were writing to me early on in the pandemic saying, don't even look at those other models. There's only one to look at, and it's Yu Yang's COVID-19 projections.com. So I started looking at yours, every day, where was it? And it was so different than the others and so much more accurate. And I just kept kind of testing it. And you were like, whoa, this is like phenomenal. You were like the oracle, the soothsayer. I mean, amazing, actually. So no wonder when you delivered on accuracy, unlike the other models of these very prestigious academic centers with teams of people. Here you are, one person, and you're coming out with better for forecasts. I mean, it's incredible. So it really, it was amazing to see this. And it went on obviously many, many months. And now you would interact with people on Twitter because some of them would challenge you or bring up controversies. How would that go?
Yeah, that was actually kind of the most surprising aspect of this whole thing, I guess, is like once, well, like I felt like, at least to me, right, like building the model part was kind of fairly straightforward in the sense that like I've had prior kind of experience just building statistical models. The hard part was kind of, well, for me at least, like when me starting Twitter and kind of trying to first advertise my model and kind of getting people to first look at it. And so that actually, I found that to be kind of the most challenging, because in the initial stages I would be just tweeting at reporters or kind of or people in academia, epidemiologists, like, hey, can you look at my model? But most of those, almost all of them, kind of just like went unresponded. And then it wasn't until kind of, I guess, it all happened in the span of like a week or two where everything just kind of blew up, I guess. And so suddenly, you had all these people that I previously weren't responding to me suddenly writing back to me like, hey, like let's talk. And yeah, in the sense then, I've been pretty active on Twitter, and I've seen a lot of different things happen on Twitter, and it's just it's been an interesting ride, I guess. And I think you're right. There's been a lot of, there's people that are very supportive, but there's also people that are very critical. And for me, I think I try to kind of take in the criticism as much as I can. And I think that's actually one of the reasons that kind of, I think my model has been so accurate, because I've been able to get that feedback from, hundreds of people at once. And of course, some people put their criticisms more nicely than others.
Right, right.
um,
Some of Twitter brings out some of the worst raw kind of communication
yeah,
responses,
I
but
agree.
you
So
always are very courteous, very respectful. That's another part about you that I think is very distinctive. I've never seen any of your responses that were, at all disparaging. You come across through social media as a, gentle, respectful, highly, obviously intelligent person. It's, a lot. You're a model,
yeah,
not just
thank
for
you. I
modeling,
appreciate it. Yeah,
but a model for communicating. Now, one of the things that was curious to me is here you then separated from the pack. You had the most accurate model for COVID-19. And then you decided in the late fall, October, November, you're going to just stop the projections. What made you do that?
yeah. So I think you touch upon it a little bit, right? Like, yeah, the, yeah. First, I appreciate you. Yeah, like your the kind words. I felt like, for me, right, like what people see on Twitter, kind of me being courteous and things, is a kind of one aspect, but it hasn't always been that way. At least for me, it's just right. Like I'm sure you've experienced this too, but like being on Twitter is sometimes just like challenging, and it's is draining.
Yes, yes.
Right, especially when you have all these people who are kind of criticizing your model. Some are valid, but a lot of times it's just not valid. And and so for me, I felt like kind of, right, like that daily kind of was a bit of, tiring me out, I guess. And kind of that it became more of a grind of kind of having to
So,
update
so
the model every day.
yeah, and you're doing this all yourself with no grants, no funding, right?
Yeah, right. So kind of yeah, up until, yeah, like, yeah, this past year I've just done everything kind of on my own. I didn't accept any donations or any grants and anything like
I mean, it's amazing. Did you have a day job to you can have food and pay your rent
that.
and whatever?
Yeah, I mean, I focused on this full time. I just was lucky, right? Like, was able to kind of support myself just for some time. Um,
Yeah.
but so I guess another reason I kind of decided to step back was kind of by the time it was October came around, the CDC had over kind of 30 models doing death forecasting. So I was just kind of one model out of 30. Whereas when I first started, I was kind of, maybe there were 5 models existing, and
Right.
most of
I,
them weren't
I,
that
I
great.
think, yeah, I think the CDC, from what I could gather, learned a lot from you. I mean, they, I think they were doing the goo adjustments in a lot of their decisions. But now, after you decided to kind of take a time out from this COVID-19 projections, you came back with the COVID-19 infections and the path to herd immunity.
Right, right.
So was that because you thought, well, I just can't stay away. I'm into this, and now we're going to the next phase, or what were you thinking when you decided you're going to go into phase 2 of goo?
Yeah, I, when I stepped back in September, October, I didn't think I would, I didn't expect to be coming back. Uh, but right, like that back then, that was when kind of that fall surge was really kind of taking off. And I think during that kind of month, I was basically taking a break. I had a lot of people kind of message me and say kind of, what, there's this really, right, there's a bad surge coming up, and we're about to kind of enter a dark period of time. But right, there's currently the kind of no, feels like there's like no guidance, especially on the modeling front. And so I've heard that from kind of many individuals, also some in kind of the public health community as well. Uh, and so that kind of got me thinking, what is it that existing models are doing that aren't doing, that would be useful. And so when I talked to kind of several people, I realized that one of the common themes was that people wanted to know what percentage of each state or the country have been infected. And that was something that kind of a lot of those models weren't doing. They were only forecasting deaths. So that's what made me decide to kind of come back and work on this infections estimate. I was dabbling in it. I think I might have sent you kind of an initial draft back in July of kind of
Yeah, yeah, I
this
remember
framework,
that.
and I
Yeah,
thought, why don't I just kind of tweak that, because it seems to be useful, and kind of make a model based off of that research that I did back in July. And so again, I just spent like a couple of days putting that together, and then I just released it, I think in November. And so that was what I've been working on since then. And of course, with the vaccine coming out, I wanted to just kind of do some modeling on that front. So that was where the path to herd immunity came about.
yeah, it's amazing actually. And here again, you distinguish yourself as, really being on top of that. I mean, one theme that I think is really important, a lesson that you have taught us, is the whole issue of simple models.
Mm.
Not like you reinforced this, having more inputs is not always the best. It's the which inputs that you focus on. Now, you were the first for me to know that the infections, that the so-called confirmed cases, is totally a miscue for how much of a burden of COVID there is. As you know, we've worked on the asymptomatic fraction and published papers on that, and found that at least 35% are asymptomatic. But what you've done through, and by the way, just for those who are um, onto this podcast, I mean, I think the point is that it's not just national that Yang does. Every state he drills down into. But the point is that you went through all the serology studies, and you recognized early on that the infection burden was far greater than the confirmed cases. At one point early on, I think it was somewhere 5 to 7-fold, and now it's narrowed to 2 to 3-fold because of more testing. But there's still your latest estimates, which coincide with the CDC, I think they got it from you again, is about 83 million people now in the US have had a COVID infection. Is that about right?
Yeah, I think as of maybe like a month ago,
Yeah,
yeah, like
yeah,
80, 90 million. And so
right,
probably now is probably, yeah, now close to 90.
right. And
100.
then on the CDC site today, it says 80, I think 83, but as you say, that's a little dated. And
Yeah.
there's been a bad January, a very bad January. So, yeah, I mean, I think, that's been enlightening. And I guess the other thing is you've been tracking, of course, all the vaccination and trying to see a path to herd immunity. So, what's your sense about where we're headed now on this exit ramp of population level immunity?
So yeah, I kind of been posting weekly updates about kind of where vaccination is going in the US. And last week, I think I sent kind of a pretty optimistic outlook where I said like maybe everybody anyone who wants a vaccine would be able to get one by April, and kind of the majority of adults in the US would be vaccinated by June. So that was kind of my estimate last week. And since then, it seems like the pace of new vaccinations has kind of plateaued. And I think you tweeted about that yesterday as well. And actually, looking at the data that was just released by the CDC maybe an hour ago, for kind of this past week, there were actually fewer new vaccinations given than the week prior,
Right,
which
right.
is concerning. So we're actually kind of slowing down in our pace of kind of getting new people vaccinated. With that said, I think there's way more second doses being administered this week than last week. So I think what's happening is that a lot of these doses are being kind of distributed and given as second doses
Right,
rather
right.
than first doses. Uh, and so, it is kind of something we have to, I'm still monitoring to see if kind of that pattern will continue, where kind of basically first doses are kind of put as kind of as a back, right, like, not as prioritized as second doses right now. So that might the increase in kind of new vaccinations may not happen for a while, and I'm not quite
Yeah,
sure.
I think your point is a really important one because even though we saw some new high marks of 1.7 million vaccines in a day
Mm.
for a couple of days in last week, there was a significant fraction of second doses in there. And so we're not making, not getting momentum on new vaccines. And I know you've seen this, Yu Yang, but many have been clamoring for just give first doses and delay the second doses so we get more people vaccinated. And that's an unsettled controversy, of course, since the data from the trials is, except for the J&J, is with 2 doses. So, it's tricky. But another thing that you and I exchange notes on, I think is really interesting. Very few people have cued into the fact that there's these 90 million Americans who've already been infected. And they already have some immunity. Maybe it's not as good as a vaccine, I think we'd agree, but it's still something. And that could be detected, in fact, guided by, quantitative rapid antibody testing as an example. But what's interesting is out of that, let's say it's rounded off by now, it could be 100 million. Some even project 100 million. I think we're exchanging notes about this. Maybe half of these people wouldn't even want to get a vaccine, right?
Yeah, if that's possible. I don't know. Kind of, I haven't seen kind of the surveys as to like what exact percentage it is. Um, but I mean, I can imagine that, yeah, percentage of those people who have been knowingly infected, right? They may not want to get another vaccine. Or yeah, when they
Well, I
come.
mean, what I think is a lot of the people, it was more likely that you would get an infection if you didn't comply with the mitigation measures. And those are the same kind of people who are, calling COVID-19 a hoax or the flu or, whatever. So out of that large body of people, large mass of people that have had infections, there's a fair number of people who, weren't going to have the vaccine no matter what. I mean, because they just don't, they're not into this. They're not with the program, if you will. So I
Right.
guess the point, I guess, is do you ever factor in with this that there's this big group of tens of millions of people that will help us get to herd immunity, or do you only count the vaccine people that get us there?
Yeah, so in my kind of path to herd immunity estimates, I do kind of assume that immunity comes from two sources: vaccination and past infection. And so I think when I don't know, I'm not sure why, but when I read the news and things like that, I don't see kind of that reference of people do have, it seems like, long
Yeah,
lasting immunity from prior infection. And so that is going to kind of give give us I don't know, I don't think head start is necessarily the right word, but it is kind of, we are starting at kind of 30%, right? 25, 30% on the way to herd immunity 60, 80%,
yeah,
rather than starting from zero. And
yeah. So this is critical. We're not going 0 to 80 or 0 to 75 or whatever that threshold is. We're going from 25 or 30 to 80. So it's a whole different look. And what I
right.
like about this, Yu Yang, is your optimism. You're, again, I have developed so much respect for your ability to forecast things using data, and I think this is very rational. That is the idea that there's a silver lining of this infection that's ripped through the United States, which is that we may be able to capitalize on that and get to herd immunity at an earlier point in time than most envisioned. Do the other models about herd immunity factor in these tens of millions of people, or do they just disregard it?
I haven't really seen many other models that tries to do this type of
Hmm.
the analysis that I did. And
Well,
so,
the
but
Washington Post had one, and they ignored it completely.
right. So from what I read on the news and such, I think I've only seen her reaching herd immunity in the context of vaccination. So if herd immunity is 70, 80%, then we need I've read that we need 70, 80% of the population vaccinated. Although I think realistically, I think it's a little bit lower, but not that much lower because of the overlap between kind of the people who were infected and then the people who are vaccinated. So,
Right, right. And
so
then, this, I don't know if you factor this in, but the immune escape and the challenges with the new strains, whether it's the UK B117 or the South African, 351, these may pose some additional stresses on us getting there, of course. But yeah,
yeah, that's the biggest challenge I think right now with kind of the model that I have as well. Like I try my best to kind of explain that it's the model only works under kind of the set of assumptions that I've
mm,
set set outlined, and that assumption only right now, and it only includes the B117 variant. But I think they kind of, just from reading kind of articles and papers from the last couple of weeks, it seems like there's kind of a lot of these other variants that are now taking place in different communities in the US. And so if those take off, and some of them are quite worrisome because they also seem to may potentially escape kind of vaccination
right, right,
immunity. And so if efficacy of the vaccine drops to 60%, then right, all bets are off with regards to kind of this current model on our path to herd immunity. And
right.
if the R increases by 50%, then that's going to significantly change the model too. So that's something that kind of I'm actively monitoring, but right now it's just kind of too early to,
Right.
try to figure out exactly what's going on. So I think we'll need to kind of wait a couple more weeks to see where things are at.
Yeah, no, that's important. My friend Mike Ulsterholm from University of Minnesota, he was on Meet the Press this past weekend, and he said that while things are looking a little better for the U.S. right now, we're in for the hurricane level, grade 5.
Category 5, yeah.
Yeah, you saw that probably. And
Yeah.
so, do you think that we're going to go through a really rough patch in the weeks ahead? I mean, I know this is not part of the path to herd immunity, but it's like a bump in the road here, a major bump because of the B117. In San Diego, we're estimating it right now at about 7%. And obviously, it's not homogeneous throughout the country. But what's your sense about the next phase of the pandemic in the U.S.?
Yeah, so I've been, that's the kind of my focus these next few weeks is kind of looking at the variants and trying to see if I can incorporate them or not into my modeling. And I think kind of from a public health perspective, it's important to right, like lay out kind of the worst case scenario of what could happen. And given kind of what we've seen in other countries like Israel, UK, Czech Republic, right? Like this kind of fourth wave is definitely very well in our realm of possibility. Uh, with that said, I'm not sure if that's kind of like right. It's not a certainty, right? We're not. It's not guaranteed that we're going to see this, fourth surge. And so, for me, like my modeling, you mentioned earlier that kind of, you kind of use like that. I'm optimistic, and I guess like from my viewpoint, I try to be as realistic as possible. So I'm not kind of but like I don't kind of try to present uh I try to present kind of these unbiased estimates in the
Right,
sense that right
right.
like it
No,
could be high on average, right? It could be higher, it could be lower, but it should be kind of exactly right. But understand kind of from a public health perspective, you want to kind of right have more conservative estimates because right you want to prepare for the worst case, right? That's the purpose of public health is to prepare for these worst case scenarios. So yeah, I totally understand, kind of, experts saying, there could be this potentially catastrophic surge. And I think it's
I,
possible, but I don't know if it's like that.
yeah, I hope this idea that it won't happen here comes true. But I'm afraid that this B117, which is the one that's going to dominate likely, and it's a triple whammy. It has super spreader impact and infectiousness. And many of the studies out of the UK suggest a 30% increase in lethality without the spread. And then there's also some immune escape, as we saw with the recent Novavax, where they actually did genomic sequencing in their cases. So it doesn't look good, but I hope you're right, Yang. I hope that we don't see it. I'm afraid that it's inevitable. But I also like to be optimistic like you, but I'm afraid that unless we do something more to protect ourselves, whether that's better masks or rapid home tests or all sorts of things we could do, that this might be a replay. We watched as you know, in the first wave of the pandemic, we watched UK, we watched Italy and France and Spain. And we say, oh, that won't happen here. Oh, that won't happen here. And look what happened. And you predicted all that. So now we're watching the UK, Ireland, Israel, uh, Portugal. These are countries very hard hit by this same variant. So I don't know how we could be immune from the variant, but we'll see, I guess.
Yeah. No, I totally agree, right? Like we look at, yeah, like Israel, UK, and you see kind of even though they've right put in all this effort to contain and mitigate it, it still kind of was not able to successfully kind of contain that variant. So for the US, I mean, yeah, I agree with you. It's it seems like it's inevitable. But I guess the silver lining, it's again, it's not really a silver lining, but if you look at, like, for example, California, we estimate kind of a quarter of the population have already been infected. And if you look at like LA County, it's probably closer to, 35, around 35%, maybe even up to 40% by now. So, even though that's not quite herd immunity, it does seem like kind of that may kind of in combination with the vaccines being rolled out, it might, right, I've seen your tweets about it. It really is a race, right, between vaccinations and this variant. And so
Right, right.
I hope that kind of course, we're able to kind of squeeze that out and
Yeah,
ramp up our vaccination efforts kind of just in time to really hold back this variant. I think, it's possible that we will see an increase in cases, right? That seems
yeah,
more likely than not. Uh, but maybe, just maybe, right, this existing immunity and the vaccinations is just going to be just enough to kind of prevent a full-on kind of outbreak.
yeah. I hope you're right, and that's why I've been pushing hard to get this vaccination into the highest gear possible. And that's why your point about the fact there's been a drop off in the first dose in the past week or so is also notable. Now, what I like is you provide an objective view. I mean, you're looking at data, you're projecting data. What's your overall sense about the pandemic in the United States? That is, uh, has many will say it has been botched to the nth degree and still is not on track. Is that really your thought, or is this something that you think, this is a bad virus and we just kind of worked our way through? What is your overall gestalt of this?
Yeah, definitely been a very eye-opening experience for me, just working on this over the past year. Just, being able to see kind of all the different sides and all the different arguments. And I think at the end of the day, right, like I have the data, and so I was able to kind of make a lot of test a lot of these arguments that people were making on, on both sides of and of the spectrum. And I think, fortunately, man, like the fact that it happened on election year was definitely made this pandemic a lot more political
Yeah,
than it should have been. And so, I think there's definitely, right, things we can point at and say, like, look, we definitely dropped the ball in this one. We could have done better.
right,
Uh,
right. Well, and of importance when you brought out the concept of a partial herd immunity, because places that were getting to high infection rates, the code is in many places that were hit extremely hard. Then the Great Barrington, group and others would latch on. Scott Atlas saying, "Oh, let it rip. This is our way to herd immunity." And of course, that's never really been achieved without a vaccine for a virus. So, I mean, these are like some of the political machinations that you had to deal with. Now, what's your next step? Where are you going in your career, Yang? What do you once we get through, which we will, of course, this pandemic? We may have an endemic, but we'll get through it. But what are you going to do next, you think?
I I I think it's still too early to tell. I feel like just things are just always changing, and especially over this past year, I think anything, right, like it's very hard to kind of, even for me, whose job is to predict things in the future, to predict kind of what I'm going to be doing a few months from now or kind of a year from now. And I mean, I hope, I've seen a lot of, kind of learned a lot over the past year. And I think there are definitely things that, especially, on the public health kind of modeling perspective, that could use, right, a more data oriented kind of approach to
Well, I mean,
solving problems.
yeah, but if I was at the University of Washington, the IHME, I would want to, bring you on to be running the projections. Or have any of these groups around the world that are doing this ever contacted you to try to recruit you?
uh yeah, I've had a couple of groups kind of reach out to me, not not from the University of Washington, but from yeah, and I guess
Well,
not.
they're on like CNN with Anderson Cooper almost every night, and you're the one that actually had a far more accurate um, outputs and forecasts. And you, Anderson Cooper hasn't discovered you yet, I don't think, right?
Uh, yeah, that's tough to know. Uh, but I guess I mean I don't blame them, right? Because I guess I probably don't necessarily have like that the credibility or the credentials, at least to
Well,
kind of
but
a lot of the viewers who may not know who I am versus.
well, I think I sure know. I think a lot of people in the know who you are, and I hope that this podcast will get the awareness. You're a data science prodigy. I mean, you've overtaken all the established sources in terms of coming out with really great uh, output and projections. And I guess the last thing I would ask you is there are a lot of people out there, young like you, even younger, that are thinking about this career as a data scientist, as a AI computer path in their career. What would you say to them? Because obviously there's a limited talent. There's a mismatch of people who are trained and great, great at this, thinkers like you, versus the need with across every industry. So what would be your advice as a career path?
Yeah, I think it's good to kind of explore kind of different industries and kind of see what you're interested in. I think for me that was, I think, one of the main kind of things that I was able to kind of attribute my success with COVID modeling is I've had the experience of kind of working in these different fields, from academia to finance to tech, right, to sports, and so I've learned kind of what skills are translatable from industry to industry, and also just kind of what I'm kind of good at and what I'm not good at. And so I think my advice would be kind of, right, like, don't be afraid that you may not have the kind of experience in a certain field, and to just kind of to just go for it and try. And the worst case that can happen is it doesn't work out, and so then you can just move on to the next one. And so I think for me it's just being knowing that kind of I am able to kind of keep being interested and kind of learning, continuing to hone my skills over the years, and prepare kind of my techniques. So then when something like, right, COVID came along, I was able to really kind of, right, bunker down and kind of put something together in a short amount of time. And and luckily, it was useful and people found it helpful. And so I'm just glad that I was able to kind of be a part and kind of contributing to the efforts to combat and understand COVID.
Well, you're very humble. All I would say is I can't thank you enough on behalf of the medical community. I would even venture to say so many people in the public, those who have followed you throughout both these big modeling initiatives that you took on yourself by yourself, and you transcended, in so many ways superseded the ones that were pre-existing, or in the case of the herd immunity, you're kind of standing alone in many respects. So thank you for all your effort. This has been a big consumptive affair for you. You've really, put all your effort into something that, it isn't like you're getting any benefits from it. You're just helping us all. You're a guiding light, literally, through the use of data, through the use of modeling, machine learning, AI. You're helping us every day. So, thanks for joining today. We look forward to following your career. I know without question, you've got a lot of other impacts going forward. And congratulations for all you've done to help us. Thank you.
Yeah, no, thank you, Eric. I really appreciate it. It means a lot coming from you, and I think kind of I couldn't have done, honestly, like I couldn't have done gotten to where I am today with kind of without the help of experts and people like yourself who are very big supporters of my work. And I think that also really helped in terms of kind of helping others evaluate my model to know that someone with your background and expertise kind of have that faith in my work. So I also want to thank you for kind of being one of my biggest, if not the biggest supporter. I get messages from people, reporters, be like, oh, like Eric Topol cited your work, and so I'm want to learn more about it. So
It's easy because it's the best there is out there, and we'll follow you closely. And for many years ahead, there's so many great things that will be happening in your career and the impact you have. So thanks for joining us today, and all for the listeners and people who have watched or listened to our conversation. We hope we've inspired with our first data scientist. It's overdue. And what a great one we had a chance to meet with and discuss with today. So thank you.
yeah,
Okay.
thank you for having me, and it was a pleasure to be here.